We've done so much with our partners over the last 5 years. We wanted to showcase all of the achievements, all of the people who we've collaborated with. So we wanted to have a proper celebration, but also a learning event. So we think about what's worked, what have been the barriers, and how do we move forward over the next 5 years with deploying innovation across the health and care system.
As far as working with the Innovation Agency are concerned, they're one of the strongest clinical partners that you can have. They're wonderful for getting health economic data and critically giving you introductions to key stakeholders, which makes the world of difference.
So it was myself who saw the 3D printing opportunity at one of the Innovation Scout educational events, and therefore the Innovation Agency was instrumental in making that collaboration happen.
So I think there has got to be a culture of innovation, and also for me allowing things to perhaps not always go right. So actually that support within the organisation that we're very lucky to have, so we can try things out, is vital. Focus on improvement, the importance of being person-centred and allowing things to fail now and again.
So we've had a lot of partners speaking here today. We've had NHS England, we've had our local pharmacy network, and we've had a range of other fantastic speakers. And that's a take-home message. We can only innovate properly if we collaborate and work across boundaries. The Museum of Failure is a museum that's based in Sweden and Los Angeles, and they've put together a collection of fabulous innovations that actually had great promise but for one reason or another failed. And we wanted to draw some parallels with some of the innovations in healthcare, innovations that have failed because of process, money, time, over-promising, and let's have a look at how we stop those things happening. And if we do have an innovation that looks like it's not going to be successful, let's nip it in the bud, learn from the lessons, either move on to something else or tweak it a bit so we can put it into practice successfully.
So the NHS is a huge organisation, and they need to evolve with the world around them, and they need innovation just like any other organisation. And they're big, so when they fail it can sometimes be huge.
So I suppose over the next 5 years we want to see more adoption and spread of innovation. We've got some great pockets of innovation as well as things that are spread across the region, so can we spread out those great examples of good practice right across the region? And we pull in a lot of innovations from outside the region and overseas, and we want to see more of our innovation spread out across the country and export to overseas markets, so we improve health and we also increase the economic growth of the region.